committee to order. Just a quick reminder, time flies when you're having fun, and this is our last committee meeting for our Senate Public Health and Welfare Committee. So before I forget, I want to make sure I thank each and every one of you, especially the committee. You guys have been great to work with this year. I really appreciate it. Donola has done an absolute magnificent job. We could not do the things that we got done this year without Donola. We have not DL here with us doing our tech. And I apologize, I don't remember his name. We just had DL for a long time, so Marcus is now not DL. So, and then as far as our staff, our revisors, Jenna Moyer and Eileen Ma. And these ladies have been absolutely great because there's been a lot of times I thought I had emailed them amendments or something on the schedule, and I didn't realize it until maybe 5 minutes before the meeting and sent it to them, and they were able to take care of us. So ladies, I sure appreciate that. Our legislative research assistants, Marisa Bayless and Connor Stangler. So just an absolute pleasure to work with. So with that, we are now going to turn to our first confirmation hearing. And the first step is Steve Anderson. He is the appointment for the Medicaid Inspector General. Steve, welcome to the committee.
Screwed it up that bad? Chairman Hildebrand and members of the committee, thank you for the opportunity to appear today and introduce myself. I'm Stephen Anderson, and I was appointed to be the Medicaid Inspector General by Attorney General Derek Schmidt. Sir, I understand you have a busy schedule today. If it would be okay with you, we can dispense with the reading of my testimony, and I'd be more than happy to stand for questions. If you like, I'll be happy to read my testimony.
Steve, we have your testimony in front of us, and we've had the packet for a few days now, so I believe everybody has had an opportunity to look it over. Committee, do we have any questions for Steve? Senator Gossage.
Thank you so much for being here, Steve. Could you just tell me how we know what's in the written material, but how do you see the position and why you fit?
I see the position as really important to the Medicaid program. It has many facets. It's an ever-expanding program. It really impacts a lot of people in the state of Kansas. Kansas taxpayers are subject, pay into this, so it's very important for the IG's office to protect taxpayer funds. My experience, 30 plus years in law enforcement, doing program frauds, working in Inspector General's role, I think suits me very well for looking at these programs and asking the right questions of program officials and getting down to the nitty gritty and trying to make suggestions that are going to help improve the program and increase the overall efficiency and integrity of the program. Thank you, ma'am.
Senator Petty.
Thank you, Mr. Chairman. And Steve, thank you for being here. I'm just wondering, how do you see this position as the Medicaid Inspector General different than in your current role?
My current role, of course, is the special agent in charge for the Medicaid Fraud and Abuse Division. In that role, we were limited to doing provider frauds only. The IG's office will look at eligibility issues as well as program integrity and looking at individuals within the program. But it's much more expansive. It's also not a pure law enforcement. It's also about doing audits and reviews, whereas the Medicaid Fraud and Abuse Division is primarily about doing criminal investigations.
Committee, not seeing any further questions. Steve, thank you and welcome, or thank you for your testimony and for your appointment. And we will end the hearing for the confirmation for Stephen Anderson. Stephen, thank you. Committee, what is your pleasure for this appointment? Senator Baumgartner.
Thank you, Madam Chair. We have had an opportunity to evaluate Mr. Anderson's education with more than 30 years of experience. I recommend, or I make a motion that the committee pass him out favorably.
Committee, we have a motion on the floor by Senator Baumgartner, a second by Senator Gossage to pass out the appointment recommendation favorably to the full Senate. Any discussion on this motion before we take it to a vote? Seeing none, all those in favor say aye. All those opposed? No. That motion is unanimous. Steve, good luck on the full Senate. Thank you. Committee will now turn our attention to our reappointment for Mark Ulick. He member of the University of the Kansas Hospital Authority, and Mark is with us virtually. Mark, welcome to our committee.
Thanks very much, Mr. Chairman and committee. It's a pleasure to be back, and look forward to your questions.
Mark, looks like you're muted.
Happening without my okay. So can you hear me now? Okay, Mr. Chairman and committee, thanks for having me. I was here 5 years ago, and I look forward to your questions.
Mark, thank you very much. Committee, do we have any questions for the conferee? Not seeing any. Mark, thank you very much. Committee, this does close the hearing for our appointment confirmation hearing. What is the pleasure of the committee? Senator Petty.
Thank you, Mr. Chairman. I'd recommend that we pass out Mark Ulick favorable for recommendation to the full Senate.
I have a motion on the floor by Senator Petty, a second by Senator Gossage to pass out the confirmation for Mark Ulick favorably to the full committee. Recommended for passage. Any discussion on this message before we take a vote? Seeing none, all those in favor, say aye. All those opposed, no. That motion is carried. Mark, congratulations and good luck, Senate floor.
Thank you, Mr. Chairman. Thank you, committee.
Thank you. Committee, before we get to our hearing, I would like to back up. We had a hearing Thursday on House Bill 2280. It was a pharmacist bill. If you guys remember, I had asked Alexandra Blasi to go back and look and see if she could cut out some of the new rules and regulations and the fees. She has done that and has offered an amendment. So I would like to work House Bill 2280 real quick, and I will offer this as an amendment as soon as we can get that amendment to you. If you guys remember, there was almost a $400,000 fiscal note. This will turn it back to zero and remove some of the rules and all of the new rules and regulations that weren't currently there.
Mr. Chair, I have that ready to pull up. Would you like me to share my screen?
Yes, please, Jenna.
There we go. Okay, so what you should be able to see and what I emailed to Nolan, it looks like she just sent that out, will be the proposed amendments to House Bill 2280. And it is essentially, I'm just striking a bunch of text on a bunch of different pages.
Senator Stephan.
Thank you.
Senator Stephan, I could probably explain it a little bit. So any place you see a new rules and regulations on a current statute that is stricken, and anywhere where you see a fee increase, those are stricken. So there will be no new fee increases and no new rules and regulations adopted, given the authority to the board to adopt rules and regulations. The only place you will see rules and regulations will be on a new section where it's like telehealth, or not telehealth, but telepharmacy and situations that are brand new. Senator Gossage.
Thank you, Mr. Chair. I have a question, and that is, the testimony was that the difficulty in going to out-of-state pharmacies and doing inspections, and that was costly. Can you tell us what is left in this bill? I can't pull it up just yet. That would address that.
They would absorb that through their current fee system. They would not increase fees for that.
Thank you.
Senator Petty.
Thank you, Mr. Chairman. So I am looking on page 2, and it's new section B. So maybe this is the same question as Senator Gossage just asked. But this has to do with inspections. This is all of section B is removed. Is this correct?
That is correct.
So how are inspections now paid for?
They will use their current fee funds that they currently use. They will not increase any funding to do that. Senator Stephan.
Thank you. And we have it from the revisor's office that, or from research folks, we have a fiscal note validating that this is cutting out all state general fund expense.
So there's no state general fund expense. If you remember back to the fiscal note, it was almost a $400,000 increase to for their fee funds. This will take that to zero because we're not increasing any fees. All of those are stricken. So there's no new fees in this bill now. Are there any further questions on this amendment? Seeing none, I make a motion to move my amendment. Second by Senator Erickson. I have a motion on the floor to move this amendment, and a second by Senator Erickson. Any further discussion? Senator Stephan.
I'd like to propose an amendment to this bill. I've been working with Jenna with Senate Bill 211. And I would like to put the verbiage within 211 as I discussed amending it with her to add or.
Senator, if I could, we're on the amendment, not on the bill. So unless your question is on the amendment, we need to take care of the amendment first. I did the motion. Okay, any further discussion? Senator Petty.
Sorry. So, Mr. Chairman, your amendment is, and I'm sorry I haven't been able to peruse the whole bill in this amount of time, but your amendment is taking out any fees these were fees that were imposed on the industry. Is that correct?
That is correct. Okay. Seeing no further questions, all those in favor say aye. Those opposed, no. Would you like your vote to be recorded? Okay, that amendment is added. Senator Stephan, you have another amendment?
Thank you, Chairman. Yes, I'd like to propose amendment that Jenna has relating to SB 211, which I think she's converted to an amendment that would allow patients to request FDA-approved drugs for non-FDA-approved purposes, and would allow the prescriber some liability from doing so. And within that, we should have that the controlled substances are exempted from being a part of that.
Jen, and I see an amendment up on that you're sharing. Is that the amendment that Senator Steffen's talking about?
Thank you, Mr. Chair. Yes, this is, so this is just Senate Bill 211 that we've stricken all the, enacting clause, the effective date language. And so it would just be the text of this amendment that you would be, or the text of this bill that you would be voting on with this little added provision that it would not apply to controlled substances, which are defined in, or the definition of controlled substances, which would be the schedules 1, 2, 3, 4, and 5, and 65, 5701. And so this would allow a patient that would like to be prescribed a FDA-approved medication for an off-label use. It would allow them or their legal representative to sign a liability waiver, and that liability waiver would relieve the prescribing physician from any liability due to prescribing that medicine for such off-label use. It defines off-label use, and then subsection C would just emphasize or clarify that nothing in this section would relieve the physician of their duty to receive consent from their patient before assisting in the care or treatment of any patient.
I have a motion by Dr. or Senator Steffen on the amendment. Do we have a second? Second by Senator Thompson. Do we have any discussion on this motion before we take it to a vote? Senator O'Shea.
Thank you, Mr. Chair. I have a question. Can you give me an example of a situation when this might be used?
Senator Steffen.
Thank you, Chairman. Yeah, this bill is intended to address the lack of outpatient treatments for COVID-19. We have great studies showing that hydroxychloroquine, ivermectin, and colchicine are very good antivirals. And something bizarre went on in society, and those medications were shut out, and doctors became afraid to prescribe them. And this would hopefully break the logjam in that situation.
Senator O'Shea.
Thank you, Mr. Chair. That's helpful. Are there any unintended consequences that could occur from something like this? Just curious.
Senator Steffen.
Well, there's always the potential for unintended consequences, but medications, FDA approved medications are used all the time for unapproved processes, and done so successfully over and over and over and over, and have been for decades. This just literally popped up with the COVID-19 situation, but we've been prescribing FDA-approved drugs for off-label uses for decades and decades.
Seeing no further questions, all those, Senator Gossage.
Thank you, Mr. Chair. My question is, yes, I'm aware that doctors have done this for many, many years and have discovered other uses for medications that have been FDA approved, and all they have to be is FDA approved, correct? For them to use for other purposes. But my question is, when it comes to the use of some of the medications that you mentioned, according to the American Association of Physicians and Surgeons, it wasn't, yes, there were doctors who were afraid because of the backlash, but mostly it was pharmacists who were saying, we're not allowed to fill this prescription for you. Could you address that?
Senator Steffen.
Thank you. Yes, that was a problem as well. In fact, I think in lots of states, particularly those with Democrat governors, it was ruled that they could not dispense hydroxychloroquine and some of the others. It became a very, very political problem. Yes, thank you.
Senator Petty.
I think this is a question for Senator Steffen. Where's this bill been?
Senator Steffen.
It has not been heard. It's been in public health.
So it's been on our calendar. It just hasn't had a hearing.
Correct.
Gossage.
I'm wondering then, given the fact that in order for me to get hydroxychloroquine, when I was diagnosed with COVID, I had to go to a pharmacist in Missouri to get it filled. So I'm wondering if we, and forgive me, Mr. Chair, I'm not sure how this works, but if we could add not just the prescriber, but the pharmacist as well in this release of liability.
Not seeing any further questions, although, oh, Senator Holscher.
Thank you, Mr. Chair. I have very big concerns in the respect that this bill has not had a hearing. We're not hearing from all parties that might have thoughts on this process. While I appreciate the amendment being brought up, but it strikes me that there are likely some pretty strong ramifications to this type of an amendment. So I will not be supporting it. Thank you.
Any further questions before we take a vote on this amendment? Senator Petty.
Thank you, Mr. Chairman. You know, unlike House Bill 2280 that now has made some major changes to this amendment, this bill has gone through the process. It has gone through the House. It has been vetted. This bill here, for whatever reason, has not had a hearing. I would agree with Senator Holscher that, you know, there are ramifications, and it's important for us to listen to both sides and to be able to make decisions. So I think when we're talking about pharmaceuticals and just basing it on a situation that some in this committee would not agree with on how it was handled by the medical profession and the CDC, I don't see it as being in the best interest of Kansas. And I think that it would be best vetted if we had a full hearing on it. So I will not be supporting it either.
Senator Thompson.
I support this amendment. It's time to do something like this. During the course of the pandemic, we've had all sorts of flip-flops from medical experts who recommended things that didn't work. Now we're getting forced to take vaccinations that are not vaccinations. They're actually gene therapy, whereas these, the hydroxychloroquine, the ivermectin, we know actually work. There's a huge body of evidence out there, if you're curious enough to read it, that shows that these are therapies that worked and actually prevented people from getting sick. And to restrict Kansans from being able to access this sort of, these sort of off-label use drugs is crazy when this economy could have been open months and months ago by utilizing this and by utilizing herd immunity instead of waiting for vaccination, and we continue to get the goalposts pushed farther and farther back. This is just common sense, and I support it. Thank you, Mr. Chair.
Senator Erickson.
Very quickly, thank you, Mr. Chair. I think that we need to be consistent when we're talking about right to try, personal autonomy, the freedom to try those things. And so for those reasons, I will be supporting this amendment. Thank you.
Senator O'Shea.
Thank you, Mr. Chair. I just am not comfortable without a full hearing, so I will not be supporting. Thank you.
Senator Gossage.
I would say that, to be clear, doctors can use any medication that's been FDA approved. That's not changed. That wasn't changed by the CDC. So one could say, well, this isn't even necessary. But what we saw, and not just necessarily with COVID, but other things, is doctors being a little more tentative about doing that, even though for years, using, again, hydroxychloroquine as an example, is that it was originally designed to be used for malaria, but then they found that it really helped lupus patients. So now we think of it as a drug for lupus, but it's an antiviral. So not just that, we just want them to feel more comfortable in the state of Kansas that you may do this, but they can do that now.
Are there any further questions before we take this to a vote? Just a reminder, we are voting on the Stephan Amendment, Senate Bill 211, adding that to House Bill 2280. All those in favor say aye. Those opposed, no? The ayes have it. House Bill, that amendment is adopted.
Division.
Division has been requested. All those in favor say aye, or raise your right hand. Right hand. Okay, all those opposed, raise your right hand. Vote of 5-3, that passes. Anybody else want their vote recorded?
Yes, please.
All three of the noes. Olsher, Petty, and O'Shea. Okay. Committee, what is your pleasure on House Bill 2280 as amended?
Mr. Chair,
Senator Thompson?
Mr. Chair, I move that we pass favorably House Bill 2280 as amended.
Have a motion on the floor by Senator Thompson to pass out House Bill 2280 as amended, and a second by Senator Erickson. Any discussion on this motion before we take it to a vote? Seeing none, all those in favor say aye. Those opposed, no. Ayes have it. Motion carries. Do the noes want their votes recorded? All right, committee, we will now turn our attention to the hearing on Senate Bill 303. And first, we'll have a bill explanation from the revisor's office. Jenna Moyer will give us the overview. Jenna?
Excuse me. Thank you, Mr. Chair. Good morning, members of the committee. Senate Bill 303 relates to county nursing homes and homes for the aged, and this is a separate category of adult care home facility, not the typical definition that we use in Chapter 39. These are facilities that are owned by the counties themselves, managed by the Board of County Commissioners, although they would still be subject to various state and federal regulation and oversight, making sure that those sort of basic health and safety standards are met. But this bill in Section 1 amends the statute 124909, and it says that essentially notwithstanding any other law, that no state officer, state employee, Board of County Commissioners, or any employee shall impose restrictions on a resident of one of those county homes for the aged, their right to receive or refuse visitors in a resident's room or a private room that's available to those residents, and that every resident or their legal representative would have the right to waive in writing any restrictions imposed to control or prevent the transmission of infectious disease against that county or against the city that owns that facility, or that manages that facility, during any state, including during a state of local disaster emergency declared pursuant to, this is the KEMA Law 48-932, or a state of disaster declared pursuant to 48-924, which I believe is those local states of disaster emergency. And Section 2 amends 1910, or KSA 2027-19-101A, and this would be the county home rule. You may be familiar more with the city home rule, which is a constitutional provision that would give cities the right to govern themselves in the manner that they see fit, essentially. And Kansas has adopted a statutory home rule. And so whenever a restriction is imposed, it's always our best practice to insert, this would be on page 40, lines 42 and 43, that a county could not exempt themselves under the normal purview. A county would have the right to exempt out of certain statutes that they would maybe disagree with or want to do their own thing on. And this amendment on page 4 would prohibit a county from exempting themselves out of the provisions of Section 1 here. And then Section 4 amends KSA 2027-19-4610. And this would be the same provision as in Section 1, and the same addition of language, except for it would be for a hospital that is operated by a county or by a governing board of such county, dealing with a resident's right to receive or refuse visitors. And I will know that there was a House bill that was very similar to this. I believe it was House Bill 2327, but it did not receive a hearing in Children and Seniors, to my knowledge. And so I was just checking with the revisor on that during this, so I will double check and make sure that my information is correct.
Thank you very much for that bill explanation. Committee, do we have any questions for Jenna over the bill? Senator Petty.
Thank you, Mr. Chairman. So Jenna, this bill would not allow counties to opt out of this regulation to allow visitors even under, if there were federal guidelines that said opposite. Is this correct?
That that's my understanding, is that the counties would not be allowed to opt out of this regulation or out
Thank
of
you.
this statute if it were passed.
Thank you.
Senator Baumgartner.
Mr. Chair, could research or the revisor please share with us how many of the county homes and county hospitals we have in our state?
Marisa, did you hear, or Jenna, do you have that?
I believe it's between 20 and 25 that we currently have in operation from the state. I got an email on it a few weeks ago. I could double check, but if Marisa has different numbers, she can fill that in for us.
This is Marisa from research. I don't have the number off the top of my head, but I can work with Jenna to see if we can confirm that number.
Thank you. Senator O'Shea.
Thank you, Mr. Chair. This is for the research or Jenna, but do you know the consequences of not following CMS guidelines for these nursing homes?
Thank you, Mr. Chair. There is a little bit of information of that on the fiscal note, and if a CMS guideline were to not be followed and a county home for the aged were to accept either Medicare or Medicaid funding, that funding could be impacted, although I can't predict with certainty exactly how that would flow through, but I would just presume that federal funding would be impacted if CMS guidelines were to be not followed by a nursing home or a county home for the aged, excuse me.
Senator Stephan.
Thank you, Chairman. Now, as I've researched the Nursing Home Reform Act of 1987, it appears to me that SB 303 actually reaffirms what's contained in that Nursing Home Reform Act. And within that Reform Act, it says that Medicare and Medicaid reimbursement is at risk if you don't follow the guidelines of the Residents' Bill of Rights, which includes basically Senate Bill 303. Any comments on that, Jenna or Chairman?
Well, I definitely have no comments on that. Jenna?
Oh, excuse me. I was just going to direct you back to the fiscal note because that's not my essentially area of expertise, but it's the information from the Kansas Association of Counties.
Senator Stephan.
Well, I would reaffirm the fact that the 1987 Nursing Home Reform Act does include a Bill of Rights that does mandate that residents are allowed visiting and have a right to visiting, and it does tie CMS reimbursement to the fulfillment of this Bill of Rights. So the biggest issue is, was there a violation of the Nursing Home Act during this virus response, and did they put their reimbursement at risk during that time period versus what we're saying at this point in time? Thank you.
Jenna, do you have a response to that, or is that something we need to research?
That has nothing to do with the text of the bill. That's more the federal regulations. And I'm hoping that there are some either proponents or opponents who can, or experts, because that's a very particular area of law, all those CMS guidelines that we just don't have time to familiarize ourselves with.
Jenna, thank you. Senator Petty.
Thank you, Mr. Chairman. Jenna, within the bill, the section that deals with hospitals, could you, I guess that's on page 6. So does this pertain to hospitals as well, or can they waive out?
Jenna?
Thank you, Mr. Chair. So the provision that deals with hospitals, it would be hospitals that are owned or operated by a county. And the provisions in section 2, let's see, we look here, would say that could not exempt or affect changes in 124909 or 192110. And so that is not listed in one that they could not exempt themselves out of in the text of the bill.
So they could not exempt themselves out if they were a county-run hospital.
That is not in the text of the bill. The two sections that are said they could not exempt themselves out of relate, they would be sections 1 and 3, related to, I'm just double checking to make sure I have this correct. Those county homes for the aged.
So I'm still not clear. So hospitals, county hospitals can or cannot waive themselves out?
It's my understanding of the bill that they could exempt themselves from the provisions.
They could exit. Okay, thank you.
Seeing no further questions for Jenna on the bill, we will now turn to proponent testimony. Proponents, we do have your written testimony. First part of this went a lot longer than I had expected. So we are going to, this is how we're going to do the proponent and opponent testimony. We are going to allow 15 minutes for proponents, 15 minutes for opponents. There is no meeting after this, so we will be able to go a couple of minutes longer, but not much, because we do have other committees we have to get to. So after 15 minutes, we will have to cut off and go on. So if someone is testifying before you and takes over 2 minutes, they're going to eat into the last conferee's time for the proponents. So if you could keep it under 2 minutes, because the proponents will have 15 minutes. We will cut off proponent testimony at 9:23. So first up, we have Senator Alicia Straub. Senator, welcome to the committee.
Thank you, Mr. Chairman and committee members. I stand before you today as a legislator, as a lawmaker, but also as a taxpayer and a former county commissioner. I'm not here today to share a personal story. I'm here to represent the very people that I serve. You can refer to my written testimony if you prefer to get the whole story, but a couple of things that I really want to cover are we as senators have been trusted with the duty of upholding the Constitution and protecting the freedoms extended to us all within it. Please put yourself in the position of these families that you're going to hear from today. This denial of basic freedom has directly affected someone that sat in your position not all that long ago. My predecessor, the Honorable Senator Larry Salmons, his family is here today. Please note that the written opposition testimony that you can all find on the committee page is from non-elected, appointed government officials. We are the lawmakers. That you also see written opposition testimony from government organizations and directors of facilities. I don't believe you will see any written opposition testimony to this bill from individuals who this has directly affected. So thank you for your time, and I kindly ask for your support of Senate Bill 303. I'll stand for questions when appropriate.
Senator, thank you. In committee, we will hold off on all questions for conferees until all the proponents have had an opportunity to speak. Next up, we have Representative Tatum Lee Hahn. Representative.
Good morning, Chairman Hildebrand and committee. I'm writing you, or I'm speaking to you today in support of SB 303. The COVID-19 debacle has been quite a journey for me and others whose families have been locked inside a nursing home facility without any recourse or remedy. People are dying. Arguably, the greatest generation is dying, and they aren't dying solely from COVID. Many are dying from isolation. The argument that CMS guidelines trump Kansans' civil liberties is simply un-American. Guidelines and regulations are not laws. Guidelines and regulations can be unconstitutional in their nature, as is the case in this instance. The Constitution doesn't go away in a pandemic. If anything, the Constitution becomes more relevant when the threat of our liberties are being infringed on. When a federal agency dangles funding as a threat, it's time that we as the state legislature step in and exercise our 10th Amendment rights. We give the power to the federal government, not the other way around. The only way that we have to stand against tyranny is to actually take our role as state legislators seriously. We are the defenders of our people, and it's time to push back. This is personal for me. I ran for the District 117 state representative position because I could find no one to help me against the overreach of the local nursing home that my grandfather is being held prisoner in. 23% of his local property taxes are paying for the nursing home he resides in, and over $6,000 is coming out of his account on a monthly basis. I stand here today because my grandfather's worth it. He's fought for me my entire life. I would urge you, get in this fight. Thank you.
Representative, thank you for your testimony. Committee, next we have Melissa Campbell. She's an individual. Melissa Campbell, not here.
I'm the next speaker. My name is Michelle Suter. I'm a business banking and real estate attorney in Leawood, Kansas. I'm a resident of Overland Park. My testimony is included in this. I am the daughter of a man who died because of this. It is very important that you protect those who cannot protect themselves, which would be young children, the elderly, and people who are infirm. We counsel people every day to get powers of attorney. I had one of those. It was ignored. I was blocked out of a hospital. I was blocked out of a nursing home only until my father was at the brink of death. My father went in because he fell down, tripping out of a car. He had a concussion, and he also had a urology issue. He was labeled COVID-19. I'm still going through medical records from my father's incarceration, which is what I call it, because we were prevented from getting in to see him. My father died due to side effects that were known from psychiatric drugs that were given to him to get his cooperation. My father has a profound hearing loss. He was denied his hearing aids and chargers. People around him wore masks. His hearing loss was not discovered until his late 70s because, as his physician said, you are a master lip reader. If you cannot hear and you cannot see the people around you, how in the heck can you follow their directions? 4 different antipsychotic and psychiatric drugs were given to him. He lost 12 pounds in 8 days. They let me in on the COVID ward. No one on there was sick. Yes, this is on his death certificate, but this is not how he died. I urge you to help people. It's unnecessary to have to do this, except in the times that we live. It's very important for people to be able to get to their people, to subjectively see how they are living. Do they have their glasses? Do they have their hearing aids? And this is not the only instance. I have another person who was not able to be here today. They were able to save their mother locally from the same fate because a pharmacist in the family used his credentials and snuck in the hospital. Please help us. Thank you.
Michelle, thank you for your testimony.
I can also speak to the Medicare reimbursement thing. This does set them up for Medicare fraud.
Thank you. Committee, next we have Marilyn Salmons, wife of former Senator Larry Salmons. Marilyn, welcome to the committee.
I am Marilyn Salmons and wife of former Larry Salmons, and I'm here because we've been in the Kansas City area for the last 6 months because Larry got West Nile virus and got sent here. And the first place we went, we picked a LTAC that had the best visiting rights. They had 8-hour visiting rights, and so we knew that was important because he was completely paralyzed. He could not talk. He had a trach in his throat. I guess if I could just get you to imagine what it's like to be laying flat on your back with no way to move and no way to talk. And then your family can't come and see you. I guess to me, it just seems like cruelty, and I would really appreciate it if you would consider any measures that you could do to alleviate this. The lady that we didn't lose him, actually, we get to take him home in 2 days from now. But we could. There were several times we could. Thanks.
Marilyn, thank you for your testimony. Next, we have Representative Trevor Jacobs. Representative, welcome to the committee.
Thank you, Mr. Chair. Thank you, Chairman Hildebrand and committee for this opportunity to stand before you and present my support for testimony of Senate Bill 303. As a fellow legislator, I'm sure we all believe the same as when it comes to our oath of office. This is a duty we all take very seriously. We all stand together in this common yet precious cause as we support the United States Constitution and the Constitution of the state of Kansas. Mr. Chair and committee, at the end of the day, we are all more than just state legislators. We are grandparents, parents, and children. Some of us have family members or friends in healthcare facilities and have been barred from having personal contact with loved ones, except maybe through a glass barrier. The importance of SB 303 is personal for me because of my private sector services. This is not only an individual liberties issue, but this is a private spiritual issue for many. Allow me to explain why I believe this. I've been ministering and preaching at nursing homes every week for 9 years. I do this to reach out to the elderly and hurting in my community, to remind them and encourage them that they are valued and loved by myself and God. Throughout my 9 years of nursing home ministries, I have knelt down and sat beside many of my little elderly friends' beds to sing to them, to hold their hands, to pray, and to read the Bible to them as they were experiencing their last days or moments of life here on earth. It has now been a year since the COVID-19 Kansas shutdowns and lockdowns, and still, many elderly people are denied basic human rights of not being allowed to have in-person visits with their loved ones or pastors. I myself am now reduced to read of updates of deceased friends or community updates. This is sad when I think of how many of our elderly are dying alone without any spiritual care. How many of our neighbors, friends, and family members have passed away all by themselves without the right of a visit from their pastor or priest? We must not allow these current denials of personal freedom to have dominion over the rights of family and pastoral visits to continue. There desperately needs to be provisions put into place that preserve and protect the liberties of these beloved aging generation. Let us not forget that this great generation once stood up for us so that we could experience the right to call our pastors and priests also. I realize that some have called this an emotionally charged issue. I would go even further than that and call this a heartbreaking travesty when the government denies the rights of a family member or pastor to say their love, I love you, and goodbyes to their dear ones is a cruelty and a shame. Comfort care should also include spiritual care. Thank you, Mr. Chair.
Thank you, Representative, for your testimony. Committee, next we have Todd Sorensen. He's an individual. Todd, welcome to the committee.
Okay. Senator Hildebrand and Senate Public Health and Welfare Committee, thank you for having me. And thank you for the time to consider these especially weighty and important matters. My name's Todd Sorensen. I reside in Olathe, Kansas. That's in Johnson County, Kansas State District 23. My mother lives in a skilled nursing home in Olathe, Kansas, and I'm here to urge you to put forth legislation that will help elderly residents maintain their freedoms. The lives of my mother and myself have been greatly impacted by the events of the last 12 months. For the last 5 years, the nursing home in which she resides has, so far, defended her right to make decisions. In that facility, she was free to get up out of her wheelchair without assistance and fall, because restraining her would limit her freedom to choose. She's also free to refuse to shower, to take her medications, and to participate in group activities. Those freedoms are a constitutional right of citizenship to choose and direct her own life. Yet for the past year, she has not been free to see her loved ones and touch them. She has not been free to invite others to visit her in her personal room, and she has not been free to see her personal physician. The effects of her loss of right to choose is devastating. She has endured loneliness, isolation, and confusion, and that's compounded her medical conditions. So I'm here to urge you to put forth legislation that will guarantee that the elderly residents maintain their freedoms. Thank you.
Todd, thank you for your testimony. Is Melissa Campbell here or not? Okay. Committee, this does conclude our proponent testimony. I will draw your attention, there are 22 written only proponents. And at this time, we will open up for questions for the proponents. Senator O'Shea.
Thank you, Mr. Chair, and thank you everyone for sharing your stories. This is a question for anyone, but why didn't you pull your loved ones from the care facilities?
We're told
As a notice
not
to
allowed to.
As a notice to anybody coming up to answer a question, for those that are attending live or listening, if you would state your name and if you represent a organization, to state that and then answer the question. So.
This is Todd Sorensen. In my case, it wasn't financially possible, so to be able to pull her and care for her at home.
Senator Thompson.
Not so much a question, but a statement. My wife and I took care of her father, who had advanced stage Alzheimer's in the final years of his life. We had to be there several times a day to make sure he was cared for properly. And this is a very high-level nursing facility. We paid thousands of dollars a month to make sure that he was cared for. And even then, these facilities are overburdened, understaffed, and for you to be able to make sure that all their care needs are taken care of, you have to be there to advocate for them. So there are a number of different situations where this is absolutely necessary, and I think it's egregious that we witnessed what we did over the course of this pandemic. Had he been in these situations during the pandemic, he would have died far earlier because of lack of contact with family members, despair, depression. It's necessary, and it's something that a nursing home, as much as they can try, as much as you can pay them, cannot fulfill, and I just support this effort. Thank you, Mr. Chair.
Representative Lehan.
Thank you, Mr. Chair. I just wanted to address the senator's question about why we didn't pull them. When someone has dementia, routine becomes very important to them. How they become like little children. And so my sister is an RN. She works in nursing homes. She works in hospice care, ironically. And one of the main reasons we didn't pull him is because he was comfortable with his setting. And to do that to him would have completely rocked his world. As a last comment, I would say that here's why: if we pass this, if we value them both as a supermajority out of this body, how hypocritical for us to not value death as much as we value life.
we have any further questions for any conferees? Senator Stefan.
Thank you, Chairman. Quick question from Ms. Suter. Again, my review of the Nursing Home Reform Act of 1987, the Bill of Rights clearly states that visitations and are their right to accept or refuse, and that CMS reimbursement is at risk if those rights are denied. Do you agree with that appraisal?
I do, Senator, and we are pursuing Medicare fraud on behalf of our family for my father's situation, and we are aware of others that are doing that, but this should be entirely unnecessary.
Senator O'Shea.
Thank you, Mr. Chair. I'm just struggling because if all of these organizations shut down as a result of this, then we really can't care for people. Thank you, Mr. Chair.
Seeing no further questions, we will now move to neutral testimony. We have one neutral, and Scott Bruner, representing KDADS. Scott, welcome to the committee.
Thank you, Mr. Chairman. I won't take much time at all. You should have a written document from me. My name is Scott Bruner. I'm the Deputy Secretary at KDADS for our state hospitals and our survey and certification unit. And we just wanted to describe in the testimony our role as a state agency in enforcing the federal rules and state rules around nursing facilities and other kinds of adult care homes. So that's in the third paragraph there. And then in the fourth paragraph, just to reinforce what's in the fiscal note around Senate Bill 303, if a nursing facility or adult care home in Kansas agrees to accept Medicare or Medicaid funding, then there are conditions of that participation, and that includes following the CMS mandates and requirements. So just to reinforce that, there would be some federal funds at risk if a facility decided to exempt themselves or not follow a federal requirement. And then just the last point, we do conduct surveys and on-site inspections of facilities and have done that with an exception of about 10 weeks or so at the beginning of the pandemic. We would need to continue doing those things, and we're under CMS direction to do that. So there could be an enforcement action levied either by the state or by CMS directly as they're enforcing their conditions of participation. But thanks for the opportunity to present just our perspective as an agency, and happy to stand for questions at the appropriate time.
Scott, thank you for your testimony. Senator Gossage.
Thank you for being here, and thank you, Mr. Chair. I just have a very quick question. You know, in all of these facilities, my mother's in one, you have staff that come and go, right? People who leave, go home, come back, they work in the kitchen, whatever. I'm trying to understand how that's different to let a family member in a private room to come in and see their loved one.
The federal requirement around visitors and people who would come in and out, it did put limits on the outside staff. So if it was a contractor, like a contract physician or somebody that was needed to do service on a piece of equipment, those folks were restricted. But if you were a staff member, that was seen as a different category of person. Those staff members were then required to be screened when they come and go, and they are required to be tested on a regular basis based on the federal timelines that are there. So there's a little higher level of scrutiny for staff members. You're welcome.
Senator Petty.
Thank you, Mr. Chairman. You mentioned the federal funding, and could you remind us for at our nursing homes, what would that, what we'll be talking about? What amount? In an average nursing home with,
It'd be very difficult to estimate because of the case mix. So for residents at a nursing home, some could have Medicaid or not. They could draw some Medicare as well as part of the treatment. So I'd really hesitate to guess what the federal side was. We could give you the estimate for the nursing home budget for Medicaid because that's in the state budget, but the Medicare side would be pretty a challenge to figure out. But I'm happy to take a.
Am I correct in that? I mean, I don't know if it's necessarily just the county-run nursing homes, but that about 60% of their residents, I mean, is that statewide? That's about 60% of the residents in a nursing home are Medicaid eligible?
I'd want to check, Senator, so I don't give you the wrong impression. That seemed a little high, but I'd be happy to get that information and bring it back to the committee.
But it is a substantial amount of their funding.
It would
In
depend
many-
on the
In
home.
some cases, it's still a substantial amount of their funding, which would be jeopardized with this kind of, if we don't follow the CMS guidelines, those funds, whatever level they are jeopardized. Is that
It'd be at
correct?
risk.
Thank you.
Senator Baumgartner.
Thank you, Mr. Chair, and I apologize for those that are testifying. I have to go to the tax committee where we are going to be approving someone and passing out bills, but I do have a quick comment and a quick question. I think in the testimony we just heard, we heard that there was no on-site inspections those first 10 weeks of the pandemic to our homes, and I think that's part of the problem that we have experienced from the get-go, that there were no on-site inspections. I would like to know, are there any class action lawsuits with regard to civil liberties that have been filed to date against CMS or the federal government for creating these regulations that prohibited family members from being present?
Not that I'm aware of, Senator.
Where's the ACLU when we need it?
Scott, I have a couple of questions, if you'll indulge me just a bit. Medicaid pays the vast majority of nursing homes expenses, is that correct?
On a statewide basis or?
In general?
It's a proportion, and I've seen the percentage, I'm not recalling it right now, but it's a big chunk of overall long-term care expenses. It's the largest payer in the long-term care setting.
So federal Medicare reimbursement rates are very minimal, is that correct? Because they cover very little of nursing home care.
Of the long-term care stay, that's true.
Okay. So my question then goes to you as a member of KDADS. Would KDADS cite any facility based off state or federal guidance for loosening up their restrictions and allowed visitors in?
We have to follow the federal requirements for the surveys that we conduct. There are elements of that survey process that look at visitation guidelines, how visitors are let in, infection control. There's a number of elements. So if at CMS's direction, we could look at that, and we have been looking at the visitation requirements in homes as we've been doing surveys. So I think the answer is yes. We don't necessarily cite a facility for every deficiency we find. Not all of them rise to the level of what we call immediate jeopardy, where there's harm being induced or would require a fine. But we do look at those elements as part of the survey process.
And my last question was it CMS guidelines or regulations that had that asked KDADS to send a memo to nursing homes to accept COVID patients?
KDADS didn't issue a memo to nursing facilities to accept nursing home patients. There is some KDHE guidance that suggests that.
Okay. Do you know if that was CDC guidelines?
That I don't know, Senator.
Okay. Thank you. Senator O'Shea.
Thank you, Mr. Chair. Can you talk to us about licensing and what it takes to maintain a license, and what would happen if you lose your license as one of these care facilities? Thank you.
A facility lost their license, they wouldn't be an approved nursing home to operate in the state of Kansas. So they would either, if they continue to operate without a license, we'd have to enforce the state regulations in addition to federal regulations where those would play in and either close the facility or issue a financial penalty. That would be the highest level.
Thank you, Mr. Chair. If you close the facility, what happens to all the residents?
We move them to other facilities or make sure there's a transition plan in place for folks to find other accommodations or facilities in their same community as close as possible.
Senator Steffen.
Thank you, Chairman. Again, a little towards some of what you've said. Again, to not be a dead horse, but the Nursing Home Care Reform Act of 1987, that's law. And in that, I never once read that nursing homes were allowed to circumvent the law in a pandemic. And again, the CMS and Medicaid reimbursement ultimately ties into fulfillment of those Bill of Rights. Am I wrong? Am I correct? Because this fallacy, this bluff that if we don't follow regulations, that these nursing homes are going to be closed when they were in direct violation of law it's preposterous. Thank you.
Senator Erickson.
Thank you, Mr. Chair. Just a comment. As I sit here and listen to this, it seems extremely disturbing to me that our focus is on licenses and money and federal regulations and not on individual rights and liberty and quality of life. And that to me is very disturbing. And where are our priorities, for crying out loud? And where's the care for our elderly? I think that it's just shameful that we put government guidelines and regulations over people. And I think we need to really take a hard look and examine where our priorities are. And as a legislature, guess what? They want to close down nursing homes because we're not letting family in. I'll take that fight. I'll take that fight any day of the week. Thank you, Mr. Chair.
Senator O'Shea.
Thank you, Mr. Chair. This is beyond frustrating to me. I degreed in aging and seniors because I love older adults. And this is not a solution. If they are out on the street, that is not a better solution. So we have to take care of our seniors. And if a facility is shut down, tell me how that's going to be better than the current situation. We don't get to control the federal government. We don't have that control. KDADS does not have that ability to do that. We do not have the ability to control the federal government. So I think we need to aim our efforts at fighting at the federal level for them to make changes, because it's awful. It's awful what's happened. It's the big reason why I ran for this office, but this is not a solution.
Senator Erickson and Senator
Thank you, Mr.
Gossage, and then
Chair.
we'll move on.
And I know we don't want to get into a debate about this, but yes, we do control the federal government. And I beg to differ and say that here in the state of Kansas, we're going to put our elderly and quality of life and loved ones over the federal government. And that's just my opinion. Thank you, Mr. Chair.
Senator Gossage.
Thank you, Mr. Chair. We're talking about closing these. Wouldn't they at first be given an opportunity to make corrections? I mean, they don't just automatically close them.
That's right.
And we're hearing the term requirements and we're hearing the term guidelines. There are times you said requirements and others guidelines. Could you explain that to us?
With respect to visitation, it was a requirement that CMS notified facilities that they needed to close to visitors and outside staff members. So that was a condition of their participation in the Medicare and Medicaid programs.
Again, I saw the nod, but for those that are listening and not able to see you, then they do not just come in and close down a facility for whatever reason. They have an opportunity to make adjustments.
That's correct, Senator.
Thank you.
Committee, this does, Scott, thank you for your testimony. This does conclude our neutral testimony. We will now turn to our opponent testimony. And just a reminder for opponents, we are limiting to 15 minutes total for opponents. First up, we do have Rachel Monger. She with Leading Age Kansas, and she is with us virtually. Rachel, welcome to the committee.
Thank you so much, Mr. Chair. Can you hear me okay?
Yes, thank you.
Excellent. We are here in opposition to the bill. It's probably the first time I've had to oppose a bill that's felt so awful, but here we are. We know that heartbreaking is not an adequate word for what nursing home residents have had to suffer after a year in isolation. Since the day that CMS really announced that shutdown for homes, that not a day has gone by in this pandemic that we haven't heard from our nurses and from our administrators telling us about the cruelty of resident isolation, asking us when CMS would let it end. And never, ever did we imagine that a year would go by without an answer. We agree with the spirit behind this bill. I think the quickest way to get tears out of a nurse or a nursing home administrator is to ask them about this resident visitation issue and what it has done to our seniors that we're trying to care for. And you will not hear anyone talk louder, longer, more angrily about federal overreach in healthcare than nursing home providers. And part of that, the source of that anger and that frustration is because we don't have any choice but to follow it. Complying with Senate Bill 303, it would force our county-owned nursing homes to violate federal nursing home regulations. And no county-owned nursing home is going to survive the devastating penalties that would result from it, which include actual fines, but also involves the loss of their federal funding. We had some questions about the role of federal funding in long-term care. It pays for between 52 and 52% on a statewide average of all nursing home care in the state. In rural parts of the state and those counties, which is where county-owned nursing homes are, it goes much higher. We have rural homes that operate anywhere between 60 and 80% Medicaid funding in our state, because that's just how the economic realities are in those parts of Kansas. As it's been pointed out, the resident visitation restrictions that are addressed in this bill are regulatory requirements from CMS. Nursing homes must follow those requirements. It is in general, it's a to the letter following of requirements. It's not a what if situation of what happens when we don't follow federal regulations. It's very clearly laid out in their enforcement requirements. And I know there's more detail about that in KDAD's testimony of how they enforce those things. I do explain in my written testimony that residents cannot waive nursing home regulations. I tell you, if that was the case, every nursing home resident would be admitted with a file boxes full of waivers that they have signed from a nursing home to not have to follow federal requirements. In my testimony, you also have the history of our lockdown orders and the visitation guidance, if you want to read through that. And you'll see in written testimony from 2 of our members who are county-owned homes, they also detail the fact that we have tried, a lot of times nursing homes have been treated as the villains in this story. When we're just trying to keep our doors open, we're just trying to care for residents, keep our federal funding, keep going. And in the midst of that, even though in-person visitation has been limited a lot of the time, our members have tried everything they could, even though it's not the same at all. And you'll see lots of descriptions of what we've been doing to try and help our residents stay as connected as we can. I also go through federal enforcement. It's difficult sometimes to sort out ownership details for a lot of people, but in my inexpert research, although I like to think I'm pretty good at it, but I turned up 32 different counties that would possibly fall under Senate Bill 303. I listed those out in my testimony, and you'll see they do represent the most rural of our already rural state. And then at the end of my testimony, I really talk about the social costs and economic costs of rural nursing home closures and even just struggles with keeping their doors open and with responding to federal requirements. And I did actually cite a real case we had back in 2017. That's a real life example of what the effects of Senate Bill 303 would lead to in those 32 counties across the state. In 2017, Trigo Manor, which is out in Waukene, Kansas, in Trigo County, they closed. Like a lot of our rural nursing homes, they were struggling financially, struggling to meet regulations, struggling with funding. And then the worst of the worst happened, which was they got hit with a really big fine from CMS for not following federal regulations. It was about $230,000, I believe, in total. Seeing no way out, the county did end up deciding to close that home because they could not, there was no way they could keep it going after that last blow. And they had hoped in the process of closing it that they could get out of that federal fine, fought it so hard, but they could not. So the taxpayers of Trigo County ended up paying $230,000 in penalties to the federal government. And then according to an article in the Hayes Daily News, that entire cost of closing that nursing homes, paying the bills, retiring debt, that was an extra $2 million for that county.
We're
So,
going to have to move on to other testimony. I'm sorry, but we're running out of time. So
okay.
appreciate your testimony. Committee, next we have Jay Hall. He is with the General Counsel with the Kansas Association of Counties. Jay, welcome to the committee.
Thank you, Mr. Chairman and members of the committee. I will be as brief as possible. I think the CMS side has been covered pretty well by Ms. Monger. So I will talk about kind of the other side of this. We're looking at residents that and families who I certainly understand the heartfelt stories that have come out today. And I think that we all feel the pain of those individuals. But I think it's also important to look at the possibility that there may be some families and residents that were concerned about something like COVID that would have wanted to protect their family members from people incoming and outgoing, and there may have been folks that did not want to sign those types of waivers. And how do we protect those individuals? And so I think there always has to be a balance with this type of thing, because there may be people that want these type of waivers, but then you also have to protect the people that do not want those types of waivers from the individuals that do take those waivers. And I don't see that in this particular bill. I also think it's important to remember that that the guidance from CMS is something that these homes were bound by. And one other thing is just we need to remember that these are a lot of these homes that are county owned are rural in nature, and they're not in our larger metropolitan areas. They're trying to keep folks in the communities where they grew up, and that these types of things and jeopardizing their licensure could put them in situations where those individuals can't stay in those communities, and I think that would be tragic as well. So I will leave you with those comments and stand for questions at the appropriate time.
Thank you, Jay. Next, we'll go to our next opponent, which would be Tara Mays, Vice President of State Legislative and Relations with KSA. Thank you. Tara?
Thank you so much, Madam Vice Chair, Mr. Chair, members of the committee. Appreciate the opportunity to stand before you to provide some comments related to Senate Bill 303 this morning. I just want to start by recognizing and saying that your Kansas hospitals and frontline workers that continue to serve the healthcare needs of our patients certainly recognize the emotions surrounding this topic. And our hearts go out to those that have had to endure this past year. Our healthcare workers are the same people that have continued to evolve and find innovative ways to connect their patients with their families throughout the course of these difficult times. We have seen firsthand the toll that it takes on those that we are serving and the families of those that we are serving. We know, though, that it is our job, and we take very seriously our obligation to protect every single person that walks through the doors of our healthcare facilities. The truth is, when we're talking about infectious diseases, whether that's COVID, whether that's influenza, whether that's pneumonia, or any other number of conditions that are in our healthcare facilities, we have an obligation to protect patients, to protect visitors, to protect staff, to protect anyone that comes through our healthcare facility doors. We believe that Senate Bill 303 would put our state statutes out of compliance with the federal rules and regulations, as has been testified to today. But in addition, it also creates confusion about one facility type's protocols versus others. We have concerns that it would take away the ability for those closest to the situation to make timely and necessary decisions. And we think that healthcare providers and healthcare facility leadership closest to the patients in the communities are most in tune with infectious diseases happening and occurring through their communities and can be most responsive to those situations dealing with infectious disease control. We want to emphasize that we know that caretakers, healthcare providers, and healthcare facility leaderships in your hospitals and your nursing homes share and very much have aligned interests with getting patients back to their families and getting those relationships continued. We want families reunited with patients but when it comes to infectious disease, we have to weigh all of the risks involved with situations to ensure that we make the best decisions for every single person we serve. We know in the state of Kansas what happens when we get out of compliance. We've seen that in situations like Osawatomie. And so we know that we're still dealing with those compliance issues. Senate Bill 303 creates confusion, creates conflicts with other government entities, and isn't sound public policy. We ask the committee to oppose Senate Bill 303. We thank you and would be happy to stand for questions at the appropriate time.
Tara, thank you for your testimony. Committee, next we have Linda Mowbray, President and CEO of KHCA. And Linda, welcome to the committee.
Thank you. Are you able to hear me?
We are, thank you.
Thank you. I am Linda Mowbray. I'm the President and CEO of Kansas Care Association and Kansas Center for Assisted Living. We are a trade association representing nursing facilities and assisted livings across the state. Although our membership does not include many of the county-owned facilities and the county-run facilities, we're standing in opposition to Senate Bill 303 on the grounds of the necessity of following those federal guidelines. You know, our homes that are not county-owned homes suffered too. We had to follow the restrictions. We had to keep families out. That was heartbreaking for the staff. That was heartbreaking for residents. If we could do it all over again, would we do it the same way? I don't know. I can't answer that. I will say that it is so important, though, if one thing we've learned throughout this pandemic is that hearing a consistent voice, following consistent rules is necessary. Otherwise, we have confusion from all corners of the state. Passing Senate Bill 303 would put homes in 32 counties in a different category. In those same counties, there may be homes that wouldn't fall under this provision. It would be very difficult for homes to discern, what do I have to do? What do I have to follow? And for family members, you know, why can this home do this and this home not? There is the issue very realistically about the finances. Our homes are federally subsidized, whether through Medicare or Medicaid. And as my colleague Rachel Monger said, you know, it varies. And in the county, there is a higher percentage. Senator Stephan had a very good point about OBRA 87, the Reconciliation Act that changed the way nursing homes did business profoundly. That was my first year in long-term care, actually. OBRA 87 in the Bill of Rights does protect the residents. We must follow those guidelines. However, when CMS came out with their QSO memo in March of 2020, QSO 2014, that said stop the visits, we had to follow that one too. So with that, I will tell you that I understand the reasoning behind Senate Bill 303. I understand the heartache and the heartbreak, but it's just not the right vehicle to try to get what I think everyone wants, which is some kind of normalcy back with our nursing homes. Thank you, and I'll stand for questions at the appropriate time.
Thank you for your testimony. Committee, that does conclude our opponent oral testimony. Would like to draw your attention to the 6 written only opponent testimony. Committee, at this time, we will open up for questions for the opponent conferees. Senator Gossage.
Thank you. This question's for Rachel. Rachel, can you hear me?
Yes, ma'am.
You mentioned that there were some rural nursing homes that had to close because they couldn't follow the regulations. Could you expound on that, and how many nursing homes are we talking about?
I was giving the specific example out in Waukene. That was Trio Manor back in 2017, and they were having a lot of financial issues. And then when they got in trouble with the federal government for a really awful incident, it was just the nail in the coffin. And obviously, their residents were extremely unhappy that one, they were losing their access to senior care in their area, and two, they were having to pay that amount of money to both pay the federal government back for those fines and then the process of closing these homes, plus the economic uh, problems that come with losing such an economic driver in their community. So that was the story I was relaying, and just the point that when you spread that kind of experience for 32 counties, plus the loss of that economic driver, we're talking about $100+ million in losses to rural taxpayers across the state.
And then, as we heard, they could have made adjustments, but it sounded like they were having economic issues and those adjustments were not made. Correct?
So when we talk about the federal enforcement process, you do have a chance to correct. There's like a plan of correction, but that doesn't take your fines away. The fines are for what you did wrong. So you got to pay that. You're going to get punished anyways. You get a chance to correct that before they start yanking your federal funding and your licensure. So when you have something like Senate Bill 303 that would tie the hands of these homes from even doing the plan of correction, then that enforcement process just keeps marching on. So you're going to pay more and more fines and lose your funding.
Senator Petty.
Thank you, Mr. Chairman. And this is a question for Linda Mowbray. Linda, I was looking over some testimony from the nursing home, at the Attica long-term care nursing home, and the Holly, the administrator there, relayed how they did make provisions to provide for visitation for their families in a variety of ways. And and of course they were following the county guidelines. So I'm going to assume, and maybe you can clarify this, it was mentioned about 10 weeks, the first 10 weeks when things were shut down. And then would it be fair to say that within these 32 counties, we would have had a variety of different adjustments for visitation for the residents?
Thank you for that question, Senator. Attica is not a home that I represent, but Holly's testimony, I do agree with her, and that they did find some creative ways to create visitation opportunities within the home. If I understand Senate Bill 303 correctly, the county could not, or the home could not limit visitation, period. And that would be devastating because it wouldn't look into the county positivity rate. It would not take into consideration the things that have been able to allow us to open back up. We would need to have, something like this would make it more of a blanket saying you must let people in, instead of let's use common sense and see what the positivity rate is and the vaccine rate is in your county and whatnot to make those concessions.
Just a follow-up. So, Linda, then also with this legislation, it's beyond just COVID. So that would pertain to nursing homes not having the ability to make those decisions in any situation that might occur within their living facility for the safety of their residents, health safety of their residents. Would this be correct?
Thank you, Senator. That is the way I interpret it, that it's not to COVID, that it is infectious diseases or causes or whatnot. I hope the time never comes that we have to do this again or consider doing this again. But the reality is the homes need to be able to follow their federal guidance. They need to be able to have the flexibility to respond to a crisis, respond to an issue as what is known best at that time. And to have a blanket, you can't do that across a county. It really puts residents at risk. It puts family members at risk, and it could put the staff at risk as well.
Thank you.
Senator Holscher.
Thank you, Mr. Chair. I think my question's for Rachel, if she's still there. And this is kind of broad in general, but is there a process as far as removing a loved one from a facility? I mean, is it just kind of normal? Is it different in a pandemic, I guess is my question? Or does a family just basically say, we are removing this individual from this home? Or like I said, is there some different process in a pandemic?
So that process has not changed post, pre, anything pandemic. A resident is always free to leave a nursing home. Now, if they are very sick, maybe the nursing home for their own protection might have you sign an against medical advice waiver when you leave. But no, you are always free to be discharged from a nursing home.
Okay, very good. Thank you.
Senator Erickson.
Thank you, Mr. Chair. Just two quick questions for any of the opponents that would like to field them. First of all, I would like to know, who do you consider your customer? And secondly, which is most important to the residents you serve, quantity or quality of life? Thank you, Mr. Chair.
This is Rachel Monger with Leading
Go
Age
ahead,
Kansas.
Rachel.
I would say, obviously, our customer, our residents, and the families we serve, and we very much believe in quality of life, which is why we have pushed back on the federal government for a very long time on person-centered care and wanting residents to have choice as opposed to regulations and all of those restrictions. However, because we depend so heavily on federal funding, because our communities do, and because our residents themselves do, just like with everything else that we get frustrated with in the federal government and federal funding, there are strings attached, and we have to follow those if we want that federal funding.
Quick follow-up, just quickly.
Frustrating, but it is what it is.
Then, if you don't mind, quick follow-up, then if the resident is your customer and you're concerned about quality of life, how does the opposition to this bill lend to that position? Thank you, Mr. Chair.
Because if this bill passes, we cannot survive. And so this is a matter of just trying to survive, to keep these places open, to keep serving their residents at all. That has to be, we can't provide quality of life, we can't provide service if we aren't open.
Senator Gossage.
Thank you. My question is for Linda. Linda, I'll wait. I'll go ahead with my question and then you
Yes,
can
ma'am.
jump in. Did your organization or any other organizations that you're aware of reach out to the federal government and share concerns about the isolation of the patients? And did you get a response if you did?
Yes, thank you for the question. The American Healthcare Association did reach out to CMS. We've had discussions with CMS. They were very cognizant of the isolation and the collateral damage, if you will, that these regulations, that these, no visitations took into place. They were very aware, they heard our concerns, and for the most part said, for the greater good, we have to do this. For infection control purposes, this is the way it's going to be. They did give latitude to have visitation for compassion visits, for hospice visits, for transitional situations. Many of the homes were very scared to see what that looked like, and so they were hesitant. But I do know homes that did allow those compassion visits and hospice visits, even even during the most restricted time, because it was the right thing to do for the resident.
Senator Thompson and Senator Petty and then Senator O'Shea.
Thank you, Mr. Chair. For any of the opponents, though the federal government sets the standards for nursing homes, the states are responsible for monitoring and certifying that they're enforcing the law. Now, this is federal law that says in the patient's Bill of Rights that they have the right to exercise self-determination, right to participate in resident family groups. There's a whole list of these things. And so we passed this law, and in a way, it's a state affirming that we have individual rights. This idea that we should do something for the greater good is the kind of language we hear in communist countries. Have we forgotten the Bill of Rights of the United States? Should we not correct our federal government and tell them, wait a second. This is frustrating to me. I understand your concerns. You don't want to shut these places down. But by the same time, if we don't take a stand and tell them they're wrong and show them they're wrong and make us think about it, this is going to continue in perpetuity, and the next pandemic's going to come and we're going to kill more people in these nursing homes. I do not see the logic in all of this. Who do we cave to, the federal government or the individual? Anybody care to respond?
I think we, again, say it again, our members do agree with the sentiment behind that. And I think if any of you have talked to our members, you do know that. I think our ask is that we find a way to push back on the federal government. We find a way to try and fix this that doesn't put our rural healthcare, our rural long-term care and communities and taxpayers in the middle of that and put them at such great risk. I think that would be our ask.
Senator Petty.
Thank you, Mr. Chairman. I think we have to remember this is not a resolution. So if we want a resolution, that's a different story. This is legislation, which would impact their funding. Rachel, there is, you've mentioned that there are these, and provided us with a list of the 32 counties that have county-run nursing homes. And I know in the testimony that came from the nursing home in Attica, it was mentioned like they are one of the top employers or highest employers in that community. So they are a help to keep that community financially solvent in some ways. I have two questions. One, would that be true in other of those 32 counties that they could be one of the top employers, which also helps to keep up the economy so those towns stay viable in our rural areas? And two, do these 32 counties have the option for a for-profit nursing homes, or generally do they just have the option of a county-owned?
On the first question, yes, almost all of our rural homes are one of the primary economic drivers in their rural cities and counties. It's usually the school, the nursing home, the hospital. On the second question, the reason why we have so many county-owned nursing homes in those rural places is because they weren't able to attract private investors and private ownership. It is very, very difficult to keep long-term care nursing homes open in those areas, both because of the financial climate, but also because they're so small. They tend to be a lot smaller than what private investor would want to sink money into. We're talking about anywhere between 20 and 30 residents, which makes them really special places, and they provide wonderful care, but it also makes it difficult to attract for-profit ventures there. So that's why they are county-owned.
So these 32 counties that have county-owned nursing homes, with this legislation, we would potentially be shutting down access for having nursing homes in communities that have made the decision to finance them so that they could provide for their senior citizens and allow them to stay in their home communities. Would that be correct?
That is correct, and that's what happened in my example for in Trigo is they had a private nursing home there that was just going to close, and they decided they needed access to that care so much and the economic part of it that the county to take it over.
Thank you.
Senator O'Shea.
Thank you, Mr. Chair. I would argue that isolation has caused more damage than COVID ever could. I don't think we're protecting people by keeping loved ones away. I actually think it's cruel and unusual punishment. So I guess my question I'm gonna ask for Rachel is what are we doing at the state level to push back against KDADs and at the federal level to push back against CMS?
So you heard Linda talk about that a little bit with ACA, but with Leading Age National, we also have pushed very, very hard at the federal level. We push hard at the state level as well, knowing that their hands are tied, much like ours are, when it comes to CMS. The success we had is that as soon as we had vaccines rolling out is when our members, and then at the federal level as well, were pushing, and even in the media as well, not just behind the scenes, to get our visitation liberalized, because at that point, I mean, it was ridiculous that we still had the same type of restrictions in place once we had so many people vaccinated in nursing homes. And you'll see in my written testimony, I explain what the new standards are, and they are not zero, but they are much, much, much better. And it was a huge emotional day for a lot of our providers when CMS announced those new guidelines. So we are moving forward and we're doing it as quick as we can, which is a good thing.
Ready? Do we have any further questions for opponents? Okay, seeing none. Committee, we do have 6 written only opponent testimony. This will conclude our hearing on Senate Bill 303. Committee, this is our very last day to meet. Please remember to put in your packets, your conferee packets. Leave those here for Donella to pick up. And as our last thing to do, what is your pleasure for Senate Bill 303? Senator Gossage.
Mr. Chair, I move that we remove the contents of House Bill 2062 and insert the contents of Senate Bill 303 and to pass out House Bill 2062 favorably for passage.
Mr. Chair?
Yes,
If
Jenna.
I could, in order to do that, we need to pull up 2262 for working. So if you could announce final action on that before you make the motion, just procedurally, that would be great.
Jenna, is it 2062 or 22? She said 2062 and you said 2262.
The bill that we currently have, I'm double checking, would be 2262. That is, the contents have been passed out in another bill.
Okay. Jenna, thank you. So committee, we will back up and we will call up House Bill 2262 to work. What is your pleasure with House Bill 2262? Senator Thompson.
Not sure if this is the correct way to do it, but I move that we pass House Bill 2262 out favorably for passage. Is that the first order of business, Mr. Chair?
If you want to send House Bill 2262 as it currently is written out favorably for passage, that would be the correct motion.
Well, I think the intent is to alter it by inserting Senate Bill 303. So
then that would not be the correct.
Then that is not the correct way. Then I would move that we insert the contents of Senate Bill 303 into House Bill 2262 and pass out favorably as amended.
Senator, are you wishing to keep the contents of House Bill 2262 intact?
That is correct. Oh, we may need some discussion on this. Just trying to get the procedure correct, Mr. Chair.
Let me help you with your procedure. I think I understand what you're wanting to do. So I think the correct motion would be to strip the contents out of House Bill 2262, insert the contents of Senate Bill 303, and then make a motion to pass out HB 2262 favorably for passage as amended.
That is most eloquent, and I will move that motion, sir.
Okay, we have a motion by Senator Thompson, a second by Senator Stephan to strip out the contents of House Bill 2262, insert contents of Senate Bill 303, and to pass it out favorably for passage as amended. Is there any discussion on this motion before we take it to a vote? Senator O'Shea.
Thank you, Mr. Chair. We're putting our rural nursing homes as a political football against the federal regulations. Are you willing to do that at the expense of our elderly? About 900 seniors being displaced? I'm not. If you're willing to do that, you would have pulled them out of the homes. I think this bill will shut down homes. I know some of you think this is a bluff from the federal government, but I'm not willing to gamble our seniors being displaced to the streets to make a point to the federal government. And I would argue if you were willing to gamble that, you would have taken your loved ones out of the home. You didn't pull them because they needed that care. You couldn't have afforded it, and most of you probably could not have provided the care that they needed. Instead, I think we should have our organizations keep pushing CMS at a federal level. We should be pushing them at a federal level. We should keep pushing KDADs at a state level to loosen restrictions. Encourage more people to receive at-home care and to continue to innovate in this world of senior care. And finally, pull your families out of the home. Let's make a point. Thank you.
Senator Petty.
Thank you, Mr. Chairman. You know, sadly, I did not have anyone in a nursing home, but I have lost family members and friends, and I can imagine what it'd be like not to be able to visit with them. However, this was not created by government. This was a pandemic, and we were all impacted by it. Over 5,000 people died in Kansas from COVID. Over 530,000 now have died in our nation. We need to address the fact that there was a pandemic and now we have a vaccine. You may or may not have made a choice to take that vaccine. I hope you are, so that you'll help us not have to face this in the future. This legislation is punitive. It impacts our nursing homes in rural areas who are providing with the help in their counties with the support of citizens' tax dollars to provide a nursing home in those counties. Now, some of you testified, you're not in those rural counties. You don't have a loved one in a county-owned home. You have it in some other facility. We all make choices depending on their financial wherewithal or your financial wherewithal. But to cause these counties to then have to potentially shut down these nursing homes, 32 counties, because of punitive actions, because reactive, we're being the armchair quarterback after the game is over. Let's not do that. This is poor legislation. It's referred to as a resolution. This is not a resolution. This is in statute if it's passed. I think this is terrible legislation. It shows that we're really not thinking of Kansans, and we're really not respecting our loved ones. So I would vote no.
Senator Holscher.
Thank you, Mr. Chair. I think there's one thing we can all agree on. Pandemics stink. This is probably our first one, right, that we've gone through. And like many of you, I haven't seen loved ones in over a year. My kids haven't seen their grandparents in over a year. But this legislation, it's flawed in the respect that if we lose nursing homes, we lose care. Your communities also lose jobs that are important. And the fact is, this will punish the very facilities that are working so hard to help your family members make it through so you can see them again. And yes, there are options. Pull your family members out of those homes. Make a difference in getting rid of this virus, getting vaccinated, wearing masks, social distancing. And I've heard a whole lot about individual rights today. And yep, very, very important. But what about the social contract we also have with one another, with our community, and caring for each other. Again, I am very, very concerned about this bill and this action and will not be supporting it. Thank you.
Senator Stefan.
Thank you, Chairman. This pandemic was absolutely perpetrated and advanced by government. From New York to California, it was blown out of perspective. We knew early on how this virus predominantly preyed on the elderly, and yet we blatantly refused to focus attention on that, and yet turned it into a political windfall to get rid of a president, among other, and advance socialism and social issues. Pushing forward that would close nursing homes is an incredible hubris. And this continued concept to ignore individual rights in spite of our Constitution, in spite of our patient nursing home Bill of Rights, is atrocious behavior and would be incredibly poor governance. And as such, I will be supporting this bill wholeheartedly.
Senator Erickson.
Thank you, Mr. Chair. Just quickly, I would just ask any of us, would we want to be away, isolated, with no contact? Any of us right here now, from our children, our spouses, our loved ones? I don't think any of us would accept that under the guise of a federal regulation. I know I wouldn't. So for that reason, and because I respect the quality of life, I respect our elders, they deserve the same quality of life that we have enjoyed during this pandemic, I will be supporting this. Thank you, Mr. Chair.
Senator Gossage.
Thank you, Mr. Chair. My mother's 91. She lives in an independent facility, not supported by any government funds, and yet I wasn't allowed to see her. She has her own sliding glass door that just goes into her room and back out of her room. Still, we weren't able to go in and see her because they were afraid of the guidelines and that they might get, yet they had people come in that worked in there. They have a restaurant, cafeteria, people that come in and work there. They have other folks that work there that clean the rooms, et cetera. And I even asked, can I get a part-time job there where I could see my mom? And I think that this is a start. I think starting with the county nursing homes that taxpayers pay for in those counties. My inbox was jammed, and I know all of us were, from people saying, please support 303 and sharing their stories far more than just the ones that we received here. And I think we need to let them know that we do support them. We do care about their loved ones. We do want to start somewhere. And I will vote to pass this out of this committee and let this be a discussion on the Senate floor should it be allowed to be on the floor.
Senator Petty.
Mr. Chairman, maybe you might, I mean, not that it's going to make any difference, but you might now explain the process of this bill now that in the shape it's in.
Thank you for that opportunity. That was going to be my next statement after questions, because we need to clarify your motion because we used the wrong bill number. That bill number, HB 2262, was passed out with the contents of Senate Bill 298 in it Thursday or Friday. So if you would withdraw your motion and you withdraw your second, remake the motion with House Bill 2062.
That I will withdraw that motion, and again, we would strip the contents of House Bill 2062, insert the contents of Senate Bill 303, and pass out favorably as amended.
Okay, we have a motion on the floor by Senator Thompson and a second by Senator Stefan to strip the contents out of House Bill 2062, insert the contents of Senate Bill 303, and pass it out favorably for passage. All those in favor say aye. No? Senator Petty?
You were going to have questions before that.
Well, go ahead,
You have a
Senator Petty.
motion. Okay. 2062, would you, could Jenna remind us what is 2062?
Yes, Mr. Chair. Senate Bill 2062 was the State Child Death Review Board confidentiality exceptions, and the contents of that bill were passed out of this committee on March 18th, and they were combined with, like, I believe it was House Bill 2158.
So we just have this as a shell.
Yes.
And as a shell, Mr. Chairman, will this go to the floor? Thank you.
Any further questions? Okay. All those in favor say aye. Those opposed, no. The ayes have it with the noes. Division has been called. All those in favor, raise your right hand. Okay, you may lower them. All those opposed, raise your right hand. On the division vote, it was 4 for ayes and 3 for the noes. The ayes have it. Do the noes wish to be recorded?
Yes, please.
So House Bill 2062 as amended is going to the floor. Before we dismiss, I just want to make one comment. If anything, the passion in this hearing, we have come to the realization that whenever a state accepts federal dollars, that we are giving up our authority as a state and ceding it over to the federal government to pull whatever strings they want. Just as my 2 cents, let that be a caution to you as we vote on future bills that accept federal dollars. So with that, we are dismissed. Thank you.